Back in January, the hype around Ozempic and Mounjaro was everywhere. People called them miracle jabs. Pharmacies were running dry, and patients kept asking, "Where is mine?" Now it's September 2025, and the story has diverged. In the United States, approval has widened. Insurers are dangling coverage, but only for those who can afford the luxury of insurance. In Australia, the PBS has held firm. It keeps diabetes treatment affordable for all, but still locks in only obesity treatment out. So today, let's take a closer look at what's changed since January, where frustrations still burn, and what these differences mean for the year ahead. In America, the FDA has moved quickly. Wegovy, that's the higher dose semaglutide, has now been approved to reduce heart attack and stroke risk. And Mounjaro, or Zepbound, was approved for sleep apnea. On paper, that sounds like progress, doesn't it? More doctors prescribing, more insurers paying. But don't be fooled. That progress mostly helps the wealthy. Insurance in the US isn't guaranteed. If you're lucky enough to have it, you still have to fight through the red tape of your plan. If you don't, and the majority don't, those approvals are just words on paper, not medicine in your hand. This is where Australia and the US truly diverge. In Australia, the PBS covers Ozempic for diabetes at a fair and fixed price, around $31 or $7 with a concession card. That's every Australian with diabetes and not just the wealthy. But for obesity and heart protection, the PBS door stays closed. This is a sharp contrast. Universal access for diabetes here versus selective access in the US, where wealth and insurance dictate who actually benefits. Supply tell its own story. In the US, the shortages that have made headlines in 2023 and 2024 have eased. Pharmacies are restocked, and regulators crack down on those unsafe compounded versions. In Australia, it's been more complicated. Ozempic shortages are still lingering in 2025. Compounding was banned, and counterfeit pens have been ever intercepted. So doctors are writing scripts, and patients walk out of pharmacies empty handed. In the US, without insurance, you're looking at over $1,000 a month. With insurance, you still have to meet strict criteria, and it can take weeks of paperwork. In Australia, Ozempic for diabetes stay affordable through the PBS. But if you want Wegovy or Mounjaro for obesity or heart protection, it's private pay, $400 to $500 a month. Still a burden, but here's the difference. At least Australians with diabetes aren't excluded because of income or insurance. In the US, if you're poor and uninsured, you are simply shut out. So, who's really worse off? Many Australians are frustrated with PBS rules, and I get it. But Australians don't always realize how good they have it. Universal access for diabetes treatment. That's something most Americans can only dream about. Australians should be grateful for that baseline of fairness, even as they push for more. Because in the US, the so called richest country in the world, most people don't have the luxury of insurance at all. And even when they do, they're trapped in the red tape. What's worse, many Americans remain unaware that other countries like Australia have overtaken them in fairness and equity. Too many are stuck in a bubble of ignorance, believing their system is the best when it isn't. So here we are in September 2025. Approvals widening in the US, PBS holding firm in Australia, and frustrations alive in both systems. And in 2026, expect pressure in Australia to expand the PBS listing for obesity and heart risk. Expect fights in the US over whether insurers can keep restricting these drugs to a few privileged ones. These medicines are reshaping healthcare, but until access is fair and the question, where is mine, isn't going anywhere. And 2026 may be the year that question finally reaches boiling point. If you found this conversation helpful, follow me here where I'll bring you clear, simple but not simplistic, balanced, down to earth health information. No clutter, no hype, just the insights that matter on health topics that affects us all.